So hello everyone. Our today's topic our today's topic is the cardiovascular system. So first of all, suppose a patient with a cardiovascular disorder came to your clinic. What are the investigation that you should know one should do to reach out a definitive diagnosis? The first of all, number one is the history taking. So history taking is very important. So this involves the collecting information about the patient's symptoms, past medical history, family history of cardiovascular disease, patient lifestyle, factors like smoking, diet, exercise. So these are all the history taking measures that you should know and ask the patient while taking history. Second is the clinical examination. A thorough clinical examination. It may reveal the important signs symptoms that are related to cardiovascular health, like the abnormal heart sounds, irregular pulses, edema, or cyanosis. The third is the routine investigation. So, what are the routine investigation that you should know that can be done? The first is the chest X-ray. It helps to visualize the heart, lungs, blood vessels in the chest. ECG. That ECG is a device that records the heart electrical activity and can detect abnormal rhythms or sign of damage. Other important things that you can do is hematological test, blood test to assess the patient's cholesterol level, or cardiac engine test like the troponin test, electrolyte balance, or the blood cell count. That can be done. Now, what are the coming to the advanced technology, the advanced investigation, depending upon the initial finding and suspected condition? What are the further tests that may be necessary to confirm the diagnosis? The first is the echocardiography. So, echocardiography, it is done to assess the heart structure, second heart function, and third is the blood flow. So remember, echocardiography, it is a non-invasive imaging technique. Echocardiography, well, it's a non-invasive imaging technique that uses sound waves. So it uses sound waves, that is the ultrasound waves, to create the detailed images of the heart structure, chambers, valves, and blood flow pattern. So the fundamental diagnostic tool in cardiology is the echocardiography. Now, coming to the echocardiography, it can be of two types. Transthoracic echocardiography. It is the most common type of echocardiography. A device that is transducer, it is placed on the chest wall over the heart area after applying a special gel. So that will emit sound waves and receive the echoes that bounce back from the heart structure and will provide the information about the overall structure and the function of the heart. The second is the transesophageal echocardiography. In the transesophageal echocardiography, a specialized transducer, it is passed in the esophagus to obtain a clear and more detailed image of the heart. As we know that esophagus, it lies close to heart. So transesophageal echocardiography, it can provide more precise images, especially of the structures that are difficult to visualize with the transthoracic approach. Now, what does the echocardiography reveals that you should know? The first is the heart structure. The echocardiography, it shows the size, shape, and the thickness of the heart chambers, as well as the condition of the heart valves. Second, it assesses the cardiac function. It assesses the pumping action of the heart and identifies the abnormalities that are present in heart during the heart contraction or the relaxation. The third important thing that it reveals is the blood flow. Echocardiography, it reveals the blood flow through the heart chamber and the valves. So we can detect the abnormalities like regurgitation or stenosis, that is also known as the narrowing of the heart valves. Now the application of echocardiography, it helps in diagnosing various heart conditions, heart failure, congenital heart defects, valvular disorders, etc. So echocardiography, remember, it is a safe, painless and does not involve the radiation. The second test is the treadmill exercise test. Well, the treadmill exercise test, it evaluates the heart response to stress. So that is why it is useful for diagnosis the coronary artery diseases. So what are the other name of treadmill exercises test? It is also known as TMT. That means treadmill exercise test or stress test or the exercise ECG. So it is a diagnostic procedure that is used to assess the heart response to physical stress or during the exercise. So before the test, the electrodes are placed on the chest to record the heart electrical activity. So BP might also be taken at the interval during the test. The patient walks or run over the treadmill. So that is the purpose here. The patient would walk on or run on the treadmill. He will start at slow pace and gradually increase his speed. So here our goal is to evaluate the heart rate and stress the cardiovascular system. So through the test, the patient's ECG, heart rate, they are noted. So the symptoms like chest discomfort, shortening of breath or fatigue, they are continuously monitored. So the test, it is terminated when the patient reaches a target heart rate. So he experienced significant symptoms, well, ECG changes. So the TMT test, it is primarily used to detect the coronary artery diseases, which is coronary artery diseases, we know they are caused by the narrowing or the blockage of the coronary arteries. So during exercise, the heart requires more oxygen, and if arteries, if they are narrowed due to the plaque buildup, so it may lead to reduced blood flow. So that will produce symptoms like the chest pain, that is angina, or ECG changes indicative of the ischemia, that is the lack of the blood supply to the heart muscles. So a normal TMT, it suggests that the heart is functioning well during exercise without evidence of significant blockage or abnormalities in the blood flow. Whereas the abnormal findings on ECG during exercise, you may see FT segment depression or elevation or presence of symptoms like chest pain that could indicate the underlying coronary artery disease. The third method is the Holter ambulatory ECG monitoring. So it records the heart activity continuously for 24 to 48 hours, or it may be longer. So here it is a useful test for detecting the irregular heart rhythms. So Holter ambulatory ECG monitoring, other name is Holter monitoring. So what is this? It is a portable device that is used that continuously record the electrical activity of the heart over a period of time, typically the 24 to 48 hours or longer. So this monitoring allow for detection and analysis of irregular heart rhythms or arrhythmia. So the key feature of Holter ECG monitoring is to monitor and detect the abnormal heart arrhythmias that may occur during the patient daily activities or during the sleep. So since this Holter monitor, it is a small, wearable and portable device that includes the electrodes that are connected to the recording device. So this device is usually we clip on the patient's clothing. So patients are instructed to continue their usual daily activities while wearing the Holter monitor. So the symptoms may be recorded, and it may record the heart electrical activity over the monitoring period. So the Holter monitor, it helps to diagnose various cardiac arrhythmias including atrial fibrillation, bradycardia, that means the slow heart rate, tachycardia, the fast heart rate, and other irregular heart rhythms. Other method that we can use is a digital subtraction angiography. Next comes the digital subtraction angiography. It is a method to visualize the blood vessels, particularly used for assessing the arteries supplying the heart, that is the coronary artery. So it is an imaging technique that is used to visualize the blood vessels in various parts of body to detect the abnormalities, blockage or other vascular conditions. So it is a specialized form of angiography that involves using contrast media. So a contrast dye containing iodine or other radiopaque substance, it is injected into the blood vessels that are to be examined. So what will this contrast agent do? This contrast agent would highlight the blood vessels, so making them visible on the X-ray. So it produces a clear imaging of the blood vessels, enhancing their visibility of the vessels and any abnormalities that could be present. Other technology are the cardiac catheterization and coronary angiography. So they are the invasive procedure that are used to diagnose and evaluate the heart conditions, particularly those related to the coronary arteries. So the primary purpose is to assess the coronary arteries that supplies the blood to the heart muscles. So a contrast dye here is injected into the catheter directly into the coronary arteries. So this dye would make the blood vessels visible on the X-ray. What are the other intervention procedure? That could be angioplasty and the stent placement. In some cases during the same procedure, intervention cardiologist, they can perform treatment like angioplasty where a balloon it is used to open the blocked arteries, and stent placement where a small mesh tube it is inserted to keep the artery open. Other procedure like removal of plaque, thrombectomy, that is clot removal, or delivery of medication directly into the arteries can be done. Other tests are the radionuclide test that includes the multigated blood pools that are the group of the imaging technique that use small amount of radioactive material, that are the radioisotopes, to diagnose and assess the condition that are related to heart. What are the common radionuclide tests that we are used in cardiology? The first is the myocardial perfusion imaging that will assess the blood flow to the heart muscles. That involves injecting a small amount of radioactive tracer, that is the technetium or thallium, into the bloodstream. So this tracer it is taken up by the heart muscles in proportion to the blood flow. So the imaging technique, that is single photon emission CT or positron emission tomography, they are used to create images that show area of reduced blood flow to the heart. Other is the multigated acutization scan. So that is done to evaluate the pumping function of the heart chambers. So similarly, a tracer it is injected into the bloodstream, and special camera it captures the multiple images of the heart as it beat. So it can detect the abnormality in the heart function. So other tests that can be used is thallium exercise, radionuclide, angiography, etc. Now let us discuss the clinical symptoms that could be related with the cardiovascular dysfunction. The first is the dyspnea. Dyspnea, it means the shortage of breath. So it is a common symptom in various cardiac and respiratory conditions. So we can grade dyspnea into 4 types: grade 1, grade 2, grade 3 and grade 4. In grade 1, there will be no dyspnea experienced during any physical activity or exertion. In grade 2, the dyspnea it would occur during ordinary physical activity or work, whereas in grade 3 it manifests with the less than accustomed physical exertion, and in grade 4 you will see dyspnea that will occur even at rest and even without physical activity. Now how can you manage? What are the manifestation of the dyspnea? The first is the exertional dyspnea. That means there would be shortening of breath that would be experienced during physical activity or the exercise. What is orthopnea? Orthopnea means difficulty breathing while laying flat. So that can be relieved by sitting or propping up oneself with the pillows. Other terminology is the paroxysmal nocturnal dyspnea. So these are the sudden attacks of severe shortness of breath during sleep, leading the person to wake up and need to upright or stand. Other manifestation is the acute pulmonary edema, a sudden onset of severe dyspnea, cough with frothy sputum that would be either white or pink. Sweating, rapid heart rate, that is tachycardia, or there would be bluish discoloration of skin. Well, the exertional dyspnea, it is common in heart failure, COPD patients, or other respiratory and cardiovascular conditions. The orthopnea, it is frequently associated with heart failure and conditions that cause fluid buildup in the lungs, that is the pulmonary edema. The paroxysmal nocturnal dyspnea, it is classical symptom of heart failure and it often occurs due to the fluid redistribution. When the patient lay down during the sleep. The second feature that you can see is the cough. Indeed, cough, it can be a symptom of conditions like pulmonary venous hypertension, heart failure, pulmonary embolism, or respiratory issues. Pulmonary venous hypertension, in more severe cases such as the pulmonary infarction or very high pressure in the pulmonary circulation, the blood tinged sputum, it can be seen. So in acute pulmonary edema that occurs due to the acute left ventricular failure, the cough, it produces pink frothy sputum. The other thing that you would notice is the edema. That refers to the abnormal accumulation of fluid in the body tissue that would cause swelling and you will see increase in the volume of the affected area. So edema, in case of the cardiac issue, it primarily affects the lower extremities like the feet, ankle and the legs. So in the heart failure, we know that the heart ability to pump blood, it reduces. So that would reduce the ability to pump blood effectively, causes a backup of blood into the veins. So this lead to increased pressure of veins in the lower body. So when the person is standing or sitting, as gravity make it more challenging for the blood to return to the heart. So the increased pressure in the veins, that will cause fluid to leak out of the blood vessels and accumulate in the surrounding tissue. So that would cause swelling, edema, and it is most commonly seen in feet, ankles and legs. In more advanced or severe cases, the edema may extend beyond the lower extremities to involve other area of body. Apart from that, you would see ascites. Ascites, it is the accumulation of fluid within the abdominal cavity. So in the severe case of heart failure, generalized edema can progress to involve the abdomen, resulting in accumulation of fluid into the peritoneal cavity that causes ascites. So edema in the heart failure, it occurs due to the heart inability to adequately pump blood. That leads to fluid retention and increased pressure in the veins. Apart from that, you would see is pain in the right upper abdomen. In the heart failure, systemic venous congestion can cause enlarged liver, that is the hepatomegaly, due to increased pressure within the veins. So the enlarged liver, it can become tender and cause pain or discomfort in the right upper abdomen. Apart from that, you would see oliguria, that is the reduced urine output during the day, that occurs due to the fluid retention and decreased kidney perfusion that is caused by the heart failure. An enlarged and hyperdynamic left ventricle, commonly seen in conditions like mitral or aortic wall incompetence, they can cause palpitation due to the forceful heart contraction. Apart from that, you can see arrhythmias, palpitations, arrhythmias such as premature beats, sinus tachycardia, or paroxysmal tachycardia. The most important feature is the angina pectoris. So here the patient would feel pain. The site of pain, it is generally retrosternal, that is behind the sternum. So the patient experience constricting or crushing sensation in the chest. Well, the pain it can spread across the chest, arms. Commonly it involves the left side, shoulder, neck, jaws, finger, epigastric region, etc. Remember the exertional angina, it typically lasts for 1 to 5 minutes. The pain lasting only a few seconds is usually not due to ischemia. The precipitating factors like climbing stairs, anger, excitement, or it could be due to the exposure to the cold. So, well, the best treatment is rest or providing patient with sublingual nitroglycerin. So, what is the treatment relief? Is the rest or sublingual nitroglycerin or isosorbide dinitrate. It can alleviate the pain. The stable angina, it follow a predictable pattern, whereas unstable angina, it can occur at rest and it is more severe. Apart from that, the patient may go into syncope. There may be transient loss of consciousness due to the impaired cerebral perfusion. Apart from that, fatigue may be seen, poor blood supply to muscles due to reduced cardiac output can be linked to various cardiac conditions like the valvular heart diseases, coronary artery diseases, or pericardial diseases. Apart from that, the other features that could be you see is the cyanosis that can be either peripheral or central. The peripheral cyanosis, it affects the distal part, whereas the central cyanosis, it affects the mucous membrane. Now, what can you do under the examination? The examination of arterial pulse, it is an essential component of the physical examination. So you have to assess the radial artery. Which artery is commonly examined? It's the radial artery. The palpitating finger should apply moderate pressure to the artery. So it is important to compare and assess other arterial pulses. Example, opposite radial, femoral, carotid, subclavian, etc. Now in the coaction of aorta, the femoral pulse may exhibit reduced volume compared to the radial pulse. Additionally, you will find that in the femoral pulse may be delayed compared to the radial pulse. What is the reason behind that? The coaction of aorta involves narrowing or constriction of aorta that occurs typically beyond the region of left subclavian artery. So this constriction leads to increased resistance and reduced blood flow to the lower part of the body. So that results in weaker and delayed femoral pulse compared to the upper limb pulses. Now let us discuss the three important features of the pulse. That is, first is the rate. So what is the normal adult pulse rate? So the normal adult pulse rate, it ranges from 60 to 90 beats per minute. So you can get a question, a simple question in your exam. Bradycardia is when the pulse rate is below 60 beats per minute, and the tachycardia, it refers to rate when the pulse rate is above the 90 beats per minute. Second characteristic feature of pulse is rhythm. A normal pulse has a regular rhythm. However, during inspiration and during expiration, you can see sinus arrhythmia. The irregular pulses, they can be categorized as regularly, irregularly, or irregularly irregular pulses. The third important feature is the volume that refers to the amplitude or strength of the pulse wave. So volume can be described as high, normal, small, or poor. What are high volume pulses? The high volume pulses, they are also known as water hammer collapsing, or it is also known as Corrigan's pulse. They are seen due to the leakage of blood from aorta, like the aortic regurgitation, or the patent ductus arteriosus, or the left ventricle, like the ventricular septal defect. It can be also seen in high output states like anemia, hyperthyroidism, beriberi, Paget disease, etc. Now, second is low volume pulses. When the amplitude of the pulse wave is smaller, then it is known as low volume pulses. So that it happens due to various factors. Number one, due to low systolic pressure or elevated diastolic pressure. So a combination of low systolic and raised diastolic pressure could lead to low volume type pulses. Now let us discuss the various varying pulse volume. The first is the pulsus alternans. So this condition, it refers to regular pulse where alternating beats are strong and weak. So one beat is strong and other is weak, that is known as pulsus alternans. So pulsus alternans, it is typically seen in left ventricular failure. The second type is the pulsus paradoxus. So it is characterized by exaggeration of the normal decrease in the pulse amplitude during inspiration and increase during expiration. So there is a decrease, there is exaggeration of normal, decrease in pulse amplitude during the inspiration and increase during the expiration. What are the causes? The causes can be conditions like constructive pericarditis, massive pericardial effusion, etc. What are the water hammer or collapsing pulse? Water hammer characteristic refers to forceful, steep and high amplitude percussion wave that will create a sensation you will feel as similar to water hammer in a palpating hand. This sensation is likened to the sudden stoppage of flow or a sharp tap. So that is why it is known as water hammer or collapsing pulse. So these features are seen with aortic incompetence or aortic regurgitation, where the aortic valve, it does not close properly. That leads to backflow of blood into the left ventricle. Other is anacrotic pulse. So this pulse is characterized by slow, gradual rising small volume, and there is well sustained waveform. So in aortic stenosis, an anacrotic pulse, an anacrotic notch, it is observed. So it is typically associated with aortic stenosis. So it is a condition where the aortic valve, it is narrowed, that obstruct the blood flow from the left ventricle into the aorta. Other is pulsus bisferens. So this pulse typically exhibit a double peak during systole, indicating two peaks within pulse wave. So it is typically seen in aortic stenosis and aortic regurgitation. So this condition involves both narrowed aortic valve and backflow of blood into the left ventricle. Other term is dicrotic pulse. So it is a sensation that is characterized by attenuation of normal dicrotic wave that results in feeling of two impulses with each heartbeat. So that is why it is known as, so you will feel like two impulses, you will get a feeling of two impulses within each heartbeat. So one impulse occurs during the systole due to the percussion wave, and second, the lower amplitude, it occurs during diastole. So this type of pulse, it is seen in condition associated with high grade fever. Other are the pulses bigemini, trigemini or quadrigemini. Now next important is the blood pressure. So imagine it as a force exerted by our circulating blood against the walls of our arteries. Now this force, remember, this force is not constant. It fluctuates with each heartbeat. So when our heart will contract, it will pump the blood into the circulation, creating the maximum pressure. So that is known as systolic pressure. The momentary rest between the heartbeats when the heart relaxes, it represents the diastolic pressure. So how do we measure this pressure? We use a device that is known as sphygmanometer that consists of a inflatable cuff and a gauge. So two things, inflatable cuffs and a gauge. So what we do, we inflate the cuff to momentarily stop the blood flow, then suddenly deflate it. So while listening for the distinct sound through the stethoscope. So this sound would help to determine the systolic and diastolic pressure. Now the cuff size matters. The standard cuff, it is about 14 centimeter wide. That suits the average size upper arm. But for small patients, we opt for smaller cuffs, that is around 10 centimeter wide. So ensuring accuracy in blood pressure reading. And patients who are robust built, a larger cuff around 16 centimeter wide would be used, and it would prevent the inaccuracy. Now when dealing with a patient with hypertension, the blood pressure requires a comprehensive approach. We need to check it in various positions, lying down, that is supine, seated, as well as standing position. So as the blood pressure, it can fluctuate significantly based upon the posture changes. And what guides us in this measurement? It's the Korotkoff sound. So as we inflate the cuff and gradually release the pressure, we'll listen attentively through the stethoscope. So these sounds are known as Korotkoff sounds, and they are marker for determining the systolic and diastolic pressure. Next important thing is what is jugular venous pressure. So remember, jugular venous pressure evaluation, it is a crucial aspect of assessing the right heart function. So important for your exam, the jugular venous pressure, it is important to assess the right heart function. So as there are no valves separating the right atrium and the internal jugular vein, changes in the right atrial pressure, they are reflected in these veins. The vertical distance from the top of the venous column to the sternal angle, it serves as a measure of the venous pressure. So in order to measure this jugular venous pressure, a method involving 3 rulers, they are commonly used. The 2 rulers, they are held horizontally, one at the level of the blood column in the right internal jugular vein and other at the angle of Lewis. What is angle of Lewis? It is where the manubrium, it joins the body of the sternum. So the third ruler, it is used to measure the vertical distance between these 2 horizontal rulers that corresponds to the jugular venous pressure. Remember, under a normal condition, when the patient is reclined at 45-degree angle with support from the backrest or the pillow, the mean pressure ranges from 0 to 4 centimeter. But in a certain cardiac condition like the congestive cardiac failure, the jugular venous pressure, it tends to get elevated. So in case of the superior vena obstruction, the jugular venous pressure elevation occurs without the presence of pulsation. So it appears raised, but it is always non-pulsatile. Now the examination of jugular venous veins will reveal 3 positive waves. What are those? A wave, C wave and V wave. Remember for your entrance exam, A wave, C wave and so the first is the A wave. So that results from the atrial systole in the contraction of the artery. So it results from the atrial systole due to the contraction of the artery. So it is prominent in conditions like pulmonary stenosis, hypertension, tricuspid stenosis. In the atrial fibrillation, this wave is absent. Additionally, in situation where the atrial contraction it happens against a closed tricuspid valve, a giant A waves may occur. They are also known as Cannon's wave. What is C wave? You get a question multiple times in your entrance exam about this wave. So it is seen due to the bulging of the tricuspid valve into the right atrium during ventricular systole. The X trough it is result of the atrial relaxation, while the X descent it is reflect the relaxation phase of atria. So remember, in cases in condition like atrial fibrillation or tricuspid insufficiency, the X descent might be absent. So following the X descent, the V wave signifies the venous filling of the right atrium during ventricular systole. So it is exaggerated in the conditions like tricuspid incompetence, heart failure and constructive pericarditis. The Y descent, this trough follows the V wave and represents the emptying of the right atrium. So a attenuated Y descent it is observed in heart failure, constructive pericarditis and tricuspid insufficiency. Other is edema. What do you understand by edema? It refers to abnormal accumulation of fluid in the tissue, particularly either as localized or generalized swelling. The localized edema it occurs due to obstruction in the lymphatic or the venous system. On other hand, the generalized pitting edema it involves the cardiac, hepatic and the renal disorder. Mixed edema typically leads to generalized non-pitting edema, remember, and the flaresis it causes localized non-pitting edema. The different conditions that exhibit edema. The first is the cardiac edema. It is typically observed in dependent areas like legs in ambulatory patients, and so it occurs due to the heart related issue affecting the fluid dynamics. Second, it can be due to the renal disorders. Edema start over the eyelid and tends to be more noticeable over walking, and it indicates kidney related fluid imbalance. The third is the liver cirrhosis. Ascites is the accumulation of fluid in the abdomen. It is often the initial presentation before the peripheral edema becomes the evident. What is clubbing? Clubbing it is a deformity of the fingers and toes. So we define it under 4 grades: mild, moderate, severe or gross. The mild it is indicated by loss of the normal angle between the nail and the finger surface. Moderate, in addition to angle loss, nails exhibit longitudinal curving. Whereas the severe form, you will see terminal finger segment it appears like a drumstick due to the tissue swelling. The gross, this stage includes the severe clubbing of the nails and significant thickening and enlargement around the wrist and ankles. What is icterus? Icterus, we know it's also known as jaundice. So you will see yellowing of the skin and eyes. This happened due to elevated level of bilirubin in the blood. So occurrence it is observed in rare conditions like chronic hepatic congestion. So seen in heart failure and constrictive pericarditis, where the hepatic congestion leads to impaired bilirubin metabolism and jaundice. Second, pulmonary infarction. The breakdown of the red blood cells can release bilirubin that can cause in jaundice. Other are the rheumatic nodules in patient with active rheumatoid carditis, a complication of rheumatoid fever. Subcutaneous, painless and mobile nodules might be observed on the dorsal finger, wrist and elbows. So these nodules are indicative of underlying rheumatoid heart disease. What are Osler nodes? These are the small red painful nodules over the fingertips. So these are typically associated with infective endocarditis. So these nodules are considered a sign of systemic embolization and immune complex deposition.